to come back home and want to come and spend time with us and love Grenada, etc., that are trying to abuse the system and put the rest of us at risk. Individuals have made reservations as per the regulations. You must make a reservation at one of the approved facilities for at least 4 days. Individuals have made those reservations, then arrive at Morris Bishop International Airport and simply tell the health officials, yes, I made the reservations, but I have no intention of paying it because I have no money to pay it. So you all have to look after me. I reach a home.
So
And
go ahead. Yeah.
the expectation is that either we pay for them to stay somewhere or that we allow them at the last minute make a decision to allow them to go to their home, not having inspected it, not know if anyone else is home, not know how they're going to be able to look after themselves for the 4 days or anything like that, that we just make that decision right there at the airport for them. And that is reckless. It's against the regulations, so it's illegal. And it really takes the rest of us for granted and the safety and the sacrifice that we have all made. So those individuals, in my opinion, will wait at the airport until they are able to come up with an appropriate option for quarantine, or until we have been able to inspect their facility and approve it, and that may be the following day. And this is the same policy that is being done in other Caribbean islands and elsewhere. If you arrive into the country and you are unable to comply with the quarantine procedures, then we cannot just release you. So that is the policy there. We do have other individuals too that have been just trying to check out on their own before the fourth day and just deciding for themselves that they know better or that they don't care and they're going home. So these are the type of things that the health team has been dealing with.
So now that we've had these instances, how would the ministry and other officials work toward this not happening in the future? What measures would be put in place, if any, to guard against this happening from today go forward?
Well, moving forward, individuals are expected to have a non-refundable deposit for their reservations. And a reservation, as far as we're concerned, for the purpose of the regulations, means that they are going to pay or have paid to stay at the facility. And that the only homestay would be those that have been approved prior to travel. Apart from which the ministry will charge and has charged, and we have informed the police up to yesterday, individuals had to go to one of those approved facilities, police that is, to enforce the regulations. Individuals were just trying to leave on their own. So this has been a consistent struggle that we've been dealing with. And this is why we consistently say that many people tell us, and we agree, we don't have COVID here in Grenada, but we are seeing daily individuals trying to put us at greater risk. And those individuals running away from one of those facilities or so could very easily jump on a bus. And we wouldn't know because they are family, friends of us, so they look like us and would very much, very quickly integrate with us. Or could end up going to one of the parties that we're trying to discreetly have, or anywhere else, and we wouldn't know. So that's why we keep saying, that the main defense is to have the protocols followed throughout. So if somebody breaches the first line of defense, which is the quarantine and port procedures, that we have other lines of defense that will protect us all as a people.
Let's talk about security at the mandatory quarantine sites. Like you just highlighted, there have been people who ran away from quarantine. I have had somebody told me about them being able to interact with somebody that should be in mandatory quarantine, interact as in face-to-face communication, and they're not supposed to be in quarantine. How is security at the site to ensure that who's supposed to be in quarantine stay there, and who's out stay there and do not come close to the sites?
Well, the security varies from site to site. Some sites really have gone the full distance and ensuring that there's a maximum level of security. and other sites have done their best. But remember, people being placed in quarantine, even in Her Majesty's prison, with all of the strict security and bars and armed officers, and so that people escape from there sometimes. So it really, we make every effort, but what we've got to recognize, and the message has got to go out loud and clear to all of our friends and families. This should almost be on an honor system, that the government truly has to enforce and put security to make sure that you don't infect your nation, the same nation that you love so much and want to come home to and have been dying to come home to and can't wait to come home to, and want to come back for Christmas and want to come back for next year Carnival when we're safe and so, but you're going to put us at risk and jeopardize all of us simply because we ask you to spend 4 days to make sure that you are not infected. I mean, we really have to get the message out the other way around, not that government has to put all these other layers of security on people, but people have to care enough not to infect us. So as best as possible, there's security in all of the facilities. But as I've said, people escape from prison. So we monitor. And the other alternative is to only allow us a certain amount of people at a time where we can have them in the maximum security, so to speak, facilities. And that's not practical, and we shouldn't have to do that. But we all need to be our brothers' keepers, and we all need to recognize that we need to safeguard ourselves as well. The measures, the protocols, once we keep them going, and we make sure that we get the message to our family that are coming home that they have to do the quarantine, I think we will get through, and we will survive, and we will come out on the other end okay. But if we all continue to take things for granted, we will not come out on the other end of this okay.
I have also heard of reports of some returning nationals, possibly visitors, not going into quarantine for 4 days, not even for 1 day when they arrive. So I guess the first question would be, one, is this report true? And two, is that a case of the officials using their discretion with these individuals?
No, there would be no discretion allowed with respect to somebody coming from a yellow or red zone, not doing any quarantine. There will be people who have come from green zone or have been in a green zone for more than 14 days. That may have been living in New York previously, but in Barbados for more than 14 days or so, that would be allowed to enter Grenada without any quarantine. And then that would have been verified through customs and immigration, that they were in one of the other green zones, regardless of the fact that they lived in a red zone or yellow zone country. So that may be what individuals are seeing. In other words, that they know of someone who lives in New York and they see them returning out the day they came off or the day after they came off a plane. But no, the health officials have absolutely no discretion in terms of somebody returning from any of the zones that require quarantine to not have somebody go into quarantine.
And how has the arrangement with CARICOM countries been in terms of the CARICOM bubble? Has everything been running smoothly so far and everybody's on board and keeping with the protocol set out?
No, I'd say no. The CARICOM bubble has not been working smoothly. Some countries have been insisting on the PCR test, some have not. And there's been variation. There hasn't been a harmonious approach to it. There's an intention to, but to date, there is not a harmonious approach or reciprocal approach with respect to the bubble.
Which side is Grenada on, insisting on the PCR or working with the protocols in the bubble?
We have signed on and working with the protocols in the bubble.
All right, just making sure. Let's take a quick break and then we're going to come back and talk about dengue fever, which is also an issue right now. We're speaking with Minister of Health, Nickolas Steele. We're going to take a quick break and then come back inside with more discussion. This is To The Point on Classic and GBN.
You know, one day I woke up and, you know, they painted a set of pedestrian crossing all along the streets. You know, nobody told us how to use that thing properly.
I know how.
You're serious?
Every safe, good driver knows about these things. As a driver, you have to be very attentive. You know you're coming up close to a pedestrian cross, you start slowing down immediately, looking to see if there's any pedestrian on the side getting ready to cross. If there is, you stop on the line that is a certain distance before the crosswalk. Then you would see the pedestrian put their hands out, looking directly at you, indicating that they are going to cross. And only when you have come to a complete stop, that is when they will quickly and safely cross to the other side. And then you continue happily on your journey.
Stop, look, hand out, eye contact, wait for pedestrian to cross. Then you happily continue on your journey.
This message is brought to you by this group of insurance companies, the Traffic Advisory Body and the Traffic Department.
It is important to know what your road signs and markings means. The zigzag lines means you should not park in the marked area. Parking is allowed inside the solid white lines on the edge of the road. Remember, look out for pedestrians. Pedestrians, be sure the vehicle comes to a complete stop before crossing. These tips can save your life. These tips can make our roads safer for all users. Be safe, be seen, be smart. A message from the Traffic Department of the Royal Grenada Police Force.
Let's Cook Grenada, a practical culinary guide to local cuisine. Learn new ways to prepare your favorite foods or try different menus from various locations across the island. Let's Cook, Tuesdays at 8 p.m. on GBN Television, Channel 7 and 11, GBN's Facebook page, and GBN's YouTube channel. If you miss it, catch the repeat Thursdays at 10 a.m. and Sundays at 3:30 p.m.
Welcome back to The Point. We're speaking with Minister of Health, Nickolas Steele, this morning. Minister, let's get into dengue fever. Minister? Minister, can you hear me? If you can hear me, your mic is muted. Okay, hold one short moment, viewers and listeners. Let me readmit the minister. Minister, can you hear me?
Yep, I'm back. Somehow
right.
I got knocked off there.
Okay, no problem. All right, so let's get into dengue fever, which is also plaguing us during these COVIDious times as well. Just earlier this week, actually, I spoke with Mr. Kenny James in the ministry, and he was highlighting some of the things as it relates to dengue and leptospirosis cases. But from your point of view, what's the present status with those cases here in Grenada?
We have had positive cases of dengue and dengue type 3, which is a hemorrhagic type of dengue. We've had one or two positive of those as well. We have begun, as usual, the fogging, but I think what we need to be aware of is the dengue. While dengue is transmitted by the mosquito, it's an infectious disease that we need to look at similarly to the way we looked at COVID-19. COVID-19, in order for us to beat it and protect ourselves, it wasn't just the ministry that had to go out there and spray. We did do that in certain places like the bus terminus and other places, but it was each and every one of us had to take individual steps as well. The same so with dengue. We need to recognize, and the only variation in the steps is based on a recognition of how the disease is transmitted. Dengue is transmitted by the mosquito, and therefore we take the steps to prevent the mosquito from biting us. The first step is to prevent the mosquito from breeding as best as possible, and then to wear repellent or to make sure that there are no mosquitoes in our environment, so we deal with it that way. And if we do so, then we can get rid of dengue as well, and we'll bring dengue to zero. So that is the first step that I'm asking individuals to look at. We've been successful with dealing with one infectious disease, and we need to look at it the same way. Dengue is another infectious disease, and we're all in this together, and we all need to take the necessary steps. We cannot and will never get rid of dengue if it's up to the Ministry of Health alone to do fogging. It just will not be able to deal with it. In the same way, we would never have been able to deal with COVID-19 if it was just the Ministry of Health that had to go fumigate areas or disinfect areas. It would not have worked.
Speaking of fogging, there have been concerns about how effective fogging is in Grenada in terms of it killing mosquitoes. Personally, like I told Mr. James, I've seen mosquitoes swimming and diving through the fog on occasion. What are we doing to improve the fogging system around the island? I know there were a few weeks ago there have been fogging in different parishes, but what are the plans to improve that system?
But the effectiveness of fogging has always been questioned and always needs to be reevaluated consistently, because in one, as I said, it is not the only measure that should be used to defeat the mosquito, whereas in some communities or some societies it's believed as that's the silver bullet. I just need to fog, or the government just needs to fog. We also need to regularly look at whether or not the mosquitoes have developed an immunity to the chemicals that are being used. And sometimes that does occur. So every now and then the ministry has to change the type of chemical that it's using in fogging. I would like to see us move towards an organic mixture as well. And that is being looked at and being used by some of the private providers right now. And the ministry should be looking at that to see if it is feasible to implement that system instead, which would be using some organic oils as opposed to the chemical malathion that we use. So consistently, the frequency of fogging makes a difference. The chemical that is being used makes a difference, and the recognition that fogging is not the only thing that will make a difference. Yes, does cause us to constantly always have to evaluate fogging.
And what are the plans to kill breeding sites of mosquitoes? Because fogging kills the mosquitoes themselves, but we still have sites around the island. Like we say, mosquito is endemic to Grenada. But are there plans to help homeowners, even business owners, kill breeding sites for mosquitoes?
Well, this has been around for years, since colonial days. And it's been the same.
Leptospirosis. Sorry, go ahead.
We need to it's public education. The sites are around our homes. The sites are from litter, from tires, from sources for plants, etc. From our own guttering or so in our houses. We are the ones that are breeding the mosquitoes. The Aedes aegypti mosquito does not breed, so to speak, in lakes, in swamps, and so it breeds around us. So we need to clean up our litter and fix up our house where there are areas for breeding of the mosquitoes, and we will be able to fight this. The Ministry of Health goes around and inspects people's places year on year. For the last decade or decades, this has been occurring. But the mosquito still breeds because people still ignore the guidelines.
And we are also dealing with leptospirosis as well.
Yes, we have seen a couple cases of leptospirosis as well. This lepto is transmitted by rats. So it is based on the rodents that are there around. The ministry has stepped up. But again, this isn't rats infecting people from government sites. This is rats infecting people from our own homes. So unless you're giving the ministry permission to enter everybody's home and lay down the traps and poisons and so for the mosquitoes and the rats, so we have to change our habits.
Let us go to the phone lines before we take a break. Let's open the phone lines for our viewers and listeners who may have comments, questions, queries, concerns for the minister. I see the phones ringing already. The landline 435-2041, that's also the WhatsApp number. Please, only written messages on WhatsApp, no voice or video calls, no YouTube links, pictures or videos, only written messages on WhatsApp. And you can also post your comments, questions, queries, concerns on the Grenada Broadcasting Network's YouTube channel. Good morning, caller.
Yes, good morning, Blossom, and good morning to public servant Nickolas Steele. I'm just two things quickly. I'm still of the opinion that the hospital is in a bad way. I'm talking about the workers, and the problem is not really you. The problem is the allocation of funds that the government doesn't see it as a priority. Number two, Blossom, I really had to publicly say to that public servant that when he was the representative of the town of St. George, he did a good job in terms of the fair distribution of the resources of this country. I always tell him that he never play politics. Everybody got, whether it's NDC and NNP, and because he didn't do as though that is money from his pocket, he gave everybody, and I still want to compliment him for that. And finally, in terms of the dengue, there was a guy on the television last night was talking about the pawpaw syrup or something from St. Vincent. Probably, I don't know if your ministry probably could look into that recipe from the St. Vincent people to help the dengue people, the people with dengue, and also with the leptospirosis. I agree with you. That's nothing to do with government. I think people have to be more help, do proper health gene. So I'm saying to you, yes, that hospital is in a bad way. Not your fault because it's underfunded. And thank you for what you do for the tongue of people of Song of St. George, that you were fair in the distribution of the resources of the country. You didn't do as though the resources is yours, and everybody benefited. I've told you that over and over. So have a good day and all the best. Thank you.
Thank you very much. Minister?
Well, thank you, caller. And yes, there's a recognition that we need to improve the way we've been dealing with all of our hospitals, and part of that has been with the appointment of Minister Delma Thomas as with special responsibility for hospital services. So yes, the caller is correct, and we recognize resources not just in terms of funding, but also in terms of manpower from the ministerial level.
There's a WhatsApp question. Somebody's saying, can you please get your ministry to remove the shanty shack shops erected over drains and old pallets so water can flow free? Those by garbage bins where rats run freely 24 hours a day. No politics, get them removed. Our health is more important. They still have no running water and no toilets. Is that something the ministry can undertake?
The ministry can undertake in conjunction with planning. When somebody puts up a structure, it is planning, and we can work together. It's planning because it's one government that has to give the permission, or lands that will give the permission if it's government lands. If it is private property, then it is planning that would look at the structure when the structure is being erected as to whether the individual has permission or not. When somebody does go to open a facility, if it is a bar or restaurant or vendor, then the Ministry of Health gets involved in terms of certifying the place to be safe or not. So it is only at that point when you're open to the public that the Ministry of Health is involved and has a say. Prior to that, it is planning, or if it is private property, then it may be the courts or police or so. But if the individual can just be a little more specific, either through you and then you can send me the details as to where they're talking about, we can try to deal with it as best as possible.
Back to the phone line. Good morning, caller.
Good morning. Blossom.
Hi.
How are you?
I'm good.
Mr. Steele, good morning.
Good morning.
Blossom, I want to know something. Anne Marie living in the hospital, or she working in the hospital?
Let's please be respectful, please, caller.
Yes, because she's too out of order. She always finding fault. And put her there to do the work. She can't do it. Right? She must learn to have some respect and some discipline as a big old woman. Thank you.
Thank you, caller. Callers, let's please try to be respectful as...
Yeah, the caller, this caller needs to be... I found the previous caller to be most respectful this morning. Not just simply because she offered a compliment, but as a whole, she was critical where she needed to be critical, and complimented where she felt it necessary to compliment. So she called a spade wherever necessary. So I think she was, this new caller is unfair to Ms. Aben this morning.
I agree, Minister Steele. She was respectful this morning, and let's try to keep it calm and respectful and cordial on the program, please. There is a question on the WhatsApp. Right. We know there are about 4 deaths in St. Vincent from the dengue fever, and we know that people from Union Island, PT St. Vincent, and mainland St. Vincent, who have a high rate, presently visited Carriacou and PT Martinique on a regular. Can you tell us what protocol we have in place that the sister isle will stay dengue and COVID-free?
Well, it is the government protocol. All we can do is in public areas is the fogging. To protect ourselves, it's the public information, which I am doing part of now, and it's been around for decades as well, not to have mosquitoes breed on your property. Once we all do that, then we will be safe. But people visiting from other areas that have dengue or any of the other vector-borne diseases, it's a case of making sure that the vector is not breeding in our homes and our establishments.
Back to the phone line. Good morning, caller.
Good morning. Just a short question for the minister. We are hearing now that some persons are faking their COVID test results. I'd just like to know what's in place to ensure that the results being received by the persons coming in are indeed genuine. Thank you.
Thank you, caller. Minister?
Yes, we have been aware from the beginning that either persons would fake or persons may get the wrong test. And that is why the documents are inspected on arrival. It does create some of the backlog when people land because they have submitted this test result in advance. But then again, on arrival, it is checked and verified as best as possible. And I stress on the as best as possible, being able to verify whether the lab exists and that the test is correct. But it is possible that somebody may fake the document if somebody goes all to that extent to fake the document or so. I think we again, it falls back to us getting the message out. This would be a Grenadian who is looking to come back home to spend time with family, who has been missing Grenada from wherever they've been living and is going to fake a document that is going to quite possibly infect us all as a result. So we keep the 4 days quarantine for individuals, regardless of the document. if we query the document or question the document, the individual is tested right there and then on arrival as well. And we have had a couple of instances of that. And person remains in quarantine for the 4 days at least. And they may be at the discretion of the health officials. They need to keep that person longer or to charge that person for deliberately falsifying documents to health and immigration.
Do we still have a lot of PCR and rapid tests in stock?
Yes, we do. Yes, we do.
Okay, just double checking. Good morning, caller.
Good morning. Mr. Steele, I know that you are reasonably intelligent or more intelligent than a lot of us. Now, we do not expect people to be at the same level. Now, certain people have an idea as to how to portray or to say what they want to say. Some say it raw because they come out from different homes. They have different upbringing. Now, what I always say, and I would continue to say, we have to be, we need education. Now, I always say education is not as most people believe, reading, writing, and doing mathematics. Education is taking into everything into account. Some people know how to present themselves, even if they are saying something that would affect other people. They might put it in a mild way. They might put it so. We have to try to educate people. This is our concern. This is what should be our concern. Even with the virus, you are trying hard to educate people. Yet for all, they believe that maybe we are telling them or you are telling them the wrong thing. Because when you tell them to wear masks, because they're somewhat not educated as to how the virus could be transmitted, or they're getting false information. And most people cannot analyze the information they get. Because I have already said, maybe less than 40% of the world, underline the word, is uneducated. And they that rule the world, because they feel they are educated. And this is why some of us would have always problem, because we have more people. I didn't talk about reading and writing, They are not educated. We have to educate people in different fields. For example, if we take it easy and educate the people about the virus, the cause and the effect, and what the economy would be lessened and so on and so on, I think people would get and learn from that. Okay. Because everybody wants to be happy. I think they want to be happy. I want to be happy, so I don't want to see virus in Grenada and rats running all about and rats eating things, and I have to eat it too. Some shops are like that too, Thank you.
Thank you very much, caller. Minister Steele?
Well, thank you. The caller is right, and there is a responsibility from the ministry standpoint to educate, public education, and to inform as well. We make every effort, but I agree with the caller. We can always do better with that.
A YouTube question. If someone comes to Grenada without getting a COVID test, what would happen then?
Well, the airlines are not supposed to allow anybody to board the flight without a COVID test. That's coming from red and yellow zones, and the airlines have been informed, and we are aware that the airlines have not been allowing people to board without the test. On most of the flights, even the charter flights, individuals have not been allowed to. So we hope and expect that policy to continue, that individuals must have that PCR test in order to board the aircraft. But in the odd instance where somebody may have gotten through without, or that the test is inappropriate, then yet they will be tested at Morris Bishop International Airport before they're allowed to leave the airport, and quite possibly could be charged as well.
A comment on WhatsApp, comment and question. As the saying goes, if the U.S. sneezes, we catch the cold. As Grenadians living in New York, and we're seeing how the president is handling the COVID as a patient and the words that are coming from him. And now we are opening our ports to foreigners and nationals who will be visiting and maybe listening to the president. How can you handle people with that mind concept, knowing that they are not doing screening on JFK, as I was told by an immigration officer recently?
That has been a challenge, and unfortunately, in some countries, and even here, the virus has been politicized. and depending on which side of the political fence someone sits, determines how much of the science they choose to believe or follow. And this is regrettable. Thankfully, as best as possible here in Grenada, it has not been politicized, and we believe in the science here. We have had some of our methods questioned and continually in terms of us asking people to still follow protocols. And there's a bit of politics, I believe, involved in that. But I would like to think that there's more science there, that individuals will follow the procedures as we go forward. But it is always a risk that people who are coming from some of these countries that are not taking or have a large portion of their population and leaders not taking the virus seriously are coming with an attitude to Grenada of not taking the virus and the threat seriously. And that is something that we're dealing with on a daily basis. All the more reason for us to keep saying that we have to keep up the level on the second line of defense, which is all of us following the protocols when in public. We don't know somebody's politics outside there returning. We don't know whether they totally disbelieve any of the protocols that we've been following and are going to take the chance and put us at risk or not. We just know them to be friends and family.
Well, let's go back to the phone lines. Good morning, caller.
Morning, Mrs. Welch.
Morning.
Honey, I'm one of those people that have underlying condition, and I'm scared to leave my home.
Yes, go on.
I'm scared to leave my home because when I'm in the city, people with masks, but their nose is exposed.
Yes, go ahead.
Yes, that's all I have to say. Have a good day.
Okay, thank you very much, Minister. That's also a comment or question on the WhatsApp about advising people how to wear masks in public.
How to wear the mask. I mean, we have no end of that, of people not wearing the mask properly, not storing the mask properly when they take it off. It continues. It's a never-ending challenge for the ministry. It is a never-ending challenge for us in terms of just trying to have people do what they're supposed to do. So we will continue to endeavor as best as possible, and at the same time, having to spend and dedicate all of these resources at the highest level to teach people or to remind people how to wear the mask and to stay in quarantine, and to help with the mosquitoes and not breed mosquitoes, and to not breed rats around their place, and to still keep the conditions at the hospital as best as possible, and to make sure that our nurses and doctors are looked after as best as possible, and all of our community centers, etc. So it's a never-ending journey. I just say this to say that the people at the ministry, the team at the ministry, have their plate full, but we will deal with and continue to deal with as best as possible based on the resources we have with all of the health challenges that we have.
There's a question on the WhatsApp and the YouTube, but I'll try to put it in one. Earlier in the program, you mentioned that part of home quarantine requires that you be the only resident. But there is someone asking, what if there are people residing upstairs? Can you be downstairs? Can they quarantine downstairs of their home where there is people upstairs? And somebody on WhatsApp says, what if it's a four-bedroom house and one of the bedroom has its own bathroom? Can the person needing to be in quarantine be in that one room with the bathroom while other people are in the other three bedrooms?
That's why we ask people to apply at least 7 days in advance, because we do recognize in some instances, not in some instances, in all instances, we would like to inspect the property. Now, an upstairs-downstairs arrangement where there's a separate apartment downstairs can, I'm not saying in all instances will be, but the upstairs-downstairs arrangement can be approved once they meet the certain criteria. I would say it's safe to say that the four-bedroom with one bedroom with its own bathroom would not meet the criteria. that would not meet the criteria now. But self-contained units with their own kitchen, bathroom, toilet, etc., separate access, and the ability for us to feel comfortable that there would be no interaction and with people coming and going. Those kind of things can be approved.
All right. Good morning, caller.
Good morning. Good morning.
Morning. Go ahead.
I want to make mention of a young man, who mentioned the fact that we need education with this virus and with any other virus that may come about, or anything like in the interest of the public. Now, at one time, not too long ago, and I think it still is possible, we used to have loudspeaker going around in the district, whether it's in the parish or in the countryside or in the town, telling people about the information that they need to know. You see, not everybody has access to a TV at the time and even a radio. So I think that system is needed again. We need to get around the country and broadcast this information so that everybody within the hearing of the loudspeaker would at least understand or hear it and pick it up at the same time and maybe carry it along or tell somebody that the other loudspeaker is saying this and saying that. So I want to advocate that we go back to that system because it is very useful and I think it could be very helpful. The other form of education is also good, but as I said, access to the TV may be not available at the time and even the radio. So please, I wish the Ministry of Health and any ministry for that matter, when they have information, they should go back to the system of broadcasting over a PA system throughout the country. Thank you.
Thank you very much, caller. Minister?
Well, I take what the caller said, and I agree with reinforcement and reminding. And if we have to use PA systems or so, then let's do that. We did do it during the lockdown and early days of the virus. I would like to venture to say, or hazard to venture to say, that I don't think there's a single individual out there in Grenada that doesn't know that COVID-19 exists right now and that wearing the mask would be the way to protect. There are people who are choosing not to, and I think it probably would be beneficial to remind them as in whatever way possible. So PA announcements also, I think, can be reconsidered again as they were used in the past, to be used again, and for the dengue and lepto as well, to remind people of their responsibility for personal hygiene and sanitation around their own environments.
A YouTube question. I heard 2 cruise ships will be visiting and they may be using our beaches and citizens would not be allowed to interact with them. What about vendors who depend on tourism to support their families?
I know it was raised by Minister Modest yesterday. The Ministry of Tourism is working with the stakeholders, all the stakeholders, which would be the cruise ships, to find out, to find a model where possible. And I'm sure with, as was mentioned, for the vendors or those who make money from this, to find a safe way of interaction, if there is one, and if there isn't, to find an alternative for them, as they have done with or alluded to with some of the vendors being able to put their products on display and have it sold separately. So that more information would be forthcoming as we get closer and closer to that.
There is a suggestion on the WhatsApp kind of question as well. Why not upgrade Grenada's COVID-19 website so that all documents can be uploaded, similar to Barbados and Jamaica? Both these countries have a pre-approval on their site.
That is being done and should be available within the next 7 to 10 days.
All right. Another WhatsApp question. When can you construct a retaining wall in Belmont in the area where you went down? Actually, yes, that was a question the other day. I am appealing to the minister to do all he can to erect a retaining wall in the area in Belmont where he had the accident last year, Carnival. It's really dangerous and we don't want another accident which could be much worse than what Minister Steele went through. And the person also suggests any other areas on the top Belmont Road in dire need of retaining wall or guardrails. Any plans for retaining walls in those areas?
The person is helping me with the answer that yes, that is on the list, as well as the other areas. There are other areas in the Belmont, not more, I think as close as 200 yards away, where there has been a bit of a slide, and throughout the constituency as well. The fact that my vehicle and I went over there does not shove it up on the priority list because of personal experience. All of the areas remain on the list, and we have been working with, and individuals can attest to the fact that we have started a significant amount of the concrete works throughout the constituency, and will continue to do so. I try to spread it out as much as possible to make sure that each and every area gets work done. Retaining walls are sometimes one of the more expensive areas, so we aren't able to do all of them in the same period. But that one, as well as the other area in Belmont, are going to be addressed as soon as possible.
Let's take this caller. Good morning, caller.
Yes, good morning. It costs about over $400 to get a test done for COVID. Is the government doing any random testing in the meantime to see how we really are?
I didn't get that last piece, to see how we really are, and I didn't get the last piece. But the cost of the COVID test has... Sorry, go.
Yes, I think the caller was saying the test is yes, she's right, the test is $410, and I'm assuming the next part of her question would have been, is the government doing any random testing to see truly where we are, as to, whether we do or do not have community spread throughout the country? And the answer is yes. We have been doing random testing in terms of anybody who shows up at any of our facilities that we think is we suspect. And then also, in conjunction with SGU has tested in the last month close on 2,000, if not above 2,000 now, individuals, which would be a random cross-section. It starts, and their policy is anyone and everyone who has to return to campus or works on campus or is a subcontractor or contractor on campus must be tested and has been tested. And this ends up being a wide cross-section of people from all over Grenada that aren't being tested because they may have shown some symptoms, but are just being tested because of where they work. And all tests have been negative to date.
And final question, somebody says, I have a concern when my family member fell critically ill and there were no beds available at the hospital, yet we have zero known COVID cases. Is there a facility that is equipped for an outbreak, and how many can it accommodate with what type of care?
Yes, there is a facility, and the beds remain idle there. That facility has been set up, it has its beds and everything there. It's an isolation facility. With respect to individuals coming to the hospital and being told that there are no beds available, it would depend on the area that they're going to. For instance, ICU as opposed to male surgical, as opposed to maternity or so. We do have occasions where we would be at capacity or near to capacity, dealing with certain reasons for people to go to hospital. The fact that we have a system that is almost to its limit before COVID is one of the reasons that we take COVID that seriously. And that is why we keep pushing all of the various protocols that we have been pushing, is that we cannot afford to deal with COVID on top of all of the other health challenges that we have been experiencing. But to reiterate, we do have the isolation facility ready. The same 10-bed facility is there, ready to go. And that family members, I regret, but yes, it does happen depending on the ailment. There are certain times of year that maternity is filled. There are certain times of year that male surgical is filled. There are certain times of year that some of the other areas are filled. In most cases, the other areas would be spikes in our non-communicable disease, high blood pressure or sugar or so. But maternity also, regrettably, there are certain times of year that it is filled.
And finally, just out of curiosity, based on the protocols, is there social distancing for beds and so at the facility, considering the limited space and beds available? And this is not, to expose if there isn't. I'm just curious. I haven't been there in a while. And are patients tested before they are admitted or during their stay at the hospital on the wards?
Persons are tested. That is the protocol that we've put in place and is supposed to be followed, that individuals are tested before being admitted to the ward. Social distancing, as best as possible, yes, in terms of the distancing for beds, but in certain instances, one can agree that in terms of the care of patients, no, doctors and nurses will be closer to the patients, have to be physically attending to patients. And in certain instances where there is stress on the system or so, they would be closer than the 6-foot distancing for individuals.
Okay.
But as healthcare professionals, they would be taking the necessary procedures and safety measures as best as possible.
All right. Any final thoughts? 30 seconds as we close the program.
No, just to say I always look forward to this opportunity. One or two of the callers were spot on in terms of public education, reinforcement, and re-informing people of the threats and dangers out there, not just the COVID threat and the COVID danger and the reason to follow the protocols to protect ourselves from COVID, but the dengue threat and the lepto threat and any of the other health threats there. It is with practicing personal hygiene for ourselves and the protocols for ourselves and in our surroundings that we will keep ourselves healthy. The Ministry of Health will do its part in informing and having the information available, and also doing its part in protecting and looking after our borders, our hospitals, and our people that have succumbed to any of these, regrettably, any of these diseases or so, as we do as best as possible with individuals that succumb to any other ailment that need and they need healthcare attention. So I want to thank the team as always. I want to thank you and the station for the opportunity, and for all of the callers that called in. Not just those who called and were positive or giving praises or positive suggestions, but those who were critical too. It is only from the criticism that we can improve as well. We get suggestions as to how to improve, and we also get criticisms that cause us to look at and improve. So I want to thank all. Again, please wear your mask, practice your social distancing, and let us make every effort to protect ourselves from COVID as well as from dengue. Thank you all.
Thank you very much, Minister, and thank you for sparing some time with us this morning to reiterate and remind us of some of the things that we need to be doing in these COVIDious times. Appreciate it. Have yourself a good Wednesday.
You too, and to all of the listeners.
That was Minister of Health Nickolas Steele sharing some protocols, some adjustments to the protocols, what we need to be doing. Remember, we're in COVID times, dengue times, leptospirosis, the Tincoconias for 2020. So we thank the Minister once again. And thank you, our viewers and listeners, for tuning in. Janelle is up next with Mid-Morning Buzz. I'll be back with you tomorrow morning, God willing. Until then, stay safe. Have a wonderful, productive Wednesday.